excited to be back. We miss you ladies so much. We hope that you are out there continuing to thrive. We know that there have been some ups and some downs in this season, but we know that our God still reigns. So we are just so excited. We have some great and amazing new things for you all, some amazing content that you can share. And it's not just for you, it's for your girlfriends, it's for your coworkers, it's for strangers you meet at the grocery store, okay? Just make sure that you share, and you can follow us on Instagram. Just search Joy Girl or head on over to joygirl.org. So ladies, we have some wonderful things in store for you all. We know how important it is to make sure that your physical and mental strength is uprooted and showing bright in this season. So we are so excited. And before we get started, I want everybody to just breathe in and breathe out. It is well, ladies. It is well. So we're just going to take a moment to pray, and then we're going to get into the goodness, okay? So, Father, we thank you right now, Lord God, for what you are doing in this season. We thank you because we know that you are a sovereign God. We know that you are still the God that heals. You are still the God that brings peace, oh God. You are still the God that covers us in the chaos, God. And we thank you and honor you in this season, God. We know that without you, there is no us, God. So we love you and recognize, God, that it is still in your hands, oh God. So God, we put all of our cares, we cast every worry into your hands right now, oh God, so that you can care for those things that worry us, oh God, those things that lay heavy on our heart, God. We thank you right now for what you are continuing to do in this season, God. We honor you and we praise your holy name. In your son Jesus' name we pray. Amen and amen. Ladies, we did not forget. Yes, you still have to keep those bodies moving and active just because you're at home. This is the time to get moving. So get on up and welcome Miss Dion as she gets us active and helps strengthen those bones and those muscles that have been sitting on that couch. I know, y'all. I know. Get on up, move the tables out the way, move the chairs. If you need a little stability, just keep the chair. It's okay. But get ready to work out. Come on, Miss Dion.
Good day, Joy Girls. My name is Dion L. Stevens, and today we're going to be working just our upper body. So why don't you go ahead and grab those weights, either 2 to 5 pounds, nothing very heavy. If you do not have weights available at home, you can use water bottles or cans of vegetables or fruit. Now, when we're working out with our weights and taking care of our upper body, we're just building upper body muscles, and that is great for women, especially women once they get anywhere from 40 years and up. Weight training is amazing. You're not going to bulk up. You're not going to be looking like you're not. Just having some weight training is very healthy for you. So we're going to start with what is called a bicep curl. You're going to take your weights, put them nicely in your palms, have a firm grip but not too tight. Take your elbows and put them right next to your waist. Abs are nice and tight. Your feet should be hip width apart. Abs are up and chest is lifted. So we're going to do a set of 8. So when you curl up, ladies, come all the way up and come down so that you're almost in a little bit of an L shape with the arms, or 7. So we're going to do 8 of those, 8 and 7. Nice and easy, breathing up and down. 4, good. 3, 2, and 1. So that is called a bicep curl. That was great. You did wonderful. So now let's take those arms out. This is called a bicep press. Shoulder press, chest press, lifting up and down. Make sure your arms come to what it looks like a football goal post. So try not to have your arms flop down here. Make sure those arms are parallel, your elbows are parallel to the ground, lifting and releasing. So let's do 8 of those. Try not to lock your legs. Give me a soft bend in the knees. You see how I just kind of lowered down? You've got 4 more to go. You're doing really good. 4. There's 3. Nice. Come on. 2. You got this. You can do it. And 1. Wonderful. So now we're going to take those arms and we're going to actually press out, squeezing. That works the front of the bicep muscle. We work the front Got that curl in. So guess what we got left? We got to count it down, ladies. We only have 4 more. You got this. Don't give up on me now. Keep pressing. 4 more. And 3. Wonderful. 2. 1 more. Doesn't that feel good? You should start feeling that in your shoulders and also your arms. So this is called an upward row. So remember how you would row up. Make sure those arms are together. Your weights are facing each other almost like they want to kiss, and you row up. We only need to do 8. So I'm just going to show you a few of the upper body exercises. We're going to continue to build on our upper body regimen. We've got 4 more to go. 4, nicely done. 3, good. 2, we have 1 more. You're doing fine. And 1. Last exercise for today, and I'm going to turn slightly sideways, and then you're going to do what is called a kick back. So take your arms and press back. You're working your tricep. So remember, we worked the bicep. Whenever you work the front of a muscle, you want to work the back as well. So feet are still hip width apart, chest is lifted. In order to have a great alignment, take that head down and press. Good. 4, nicely done. I'm looking at you, but you do the work. 3, 2, 1. How does that feel? Wasn't that amazing? Last exercise of the morning, ladies, and we'll meet right back here. We're going to take those arms forward and pull back. You are working your upper back. Many women in my classes tell me, and they're like, Dion, I need to get rid of this back situation. So press back. Here we go. We only have 4 more to go. You're doing wonderful. Come on, 3 more. Push. 2. Guess what? That was it. That was not so bad now, was it? So go ahead and take a drink of water. Always know that your upper body is amazing to work on. Meet me back here. We're going to add on to our fitness regimen. Next time we meet, we're going to work the lower body. God bless you. See you next time.
Hello, ladies. I'm Miriam Salters, and I hope you have enjoyed your workout today with Dion Stevens. And now it's time for the word for today. You know, during these pandemic times, God says, I will never leave you nor forsake you. In Isaiah chapter 41, verse 10, God says this to us, fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you, I will help you, I will uphold you with the right hand of my righteousness. That's God's promise to us. He's going to strengthen us, He's going to help us. And during these times, God has brought a wonderful couple that's going to help us today. We have Dr. Victor and Sherry Blake. Dr. Victor Blake is a renowned doctor in Atlanta, Georgia. He received his degree at Mount Sinai School of Medicine in New York City. He went on to do his residency at Howard University, and now he is a professor at Morehouse School of Medicine. And this year, ladies, he received an award for Doctor of the Year. What a wonderful man of God that we will hear from today. And also we have his lovely wife, Dr. Sherry Blake. She's a well-known psychologist. Many of you have seen her on The Braxtons, The Real Housewives of Atlanta, CNN, NBC, ABC. She's also written a book entitled Single Married Women, and her latest book is entitled Caregiver. She also writes a column weekly in Essence.com. So ladies, get ready. I hope you have your pen, your pad, and if necessary, your eyeglasses. And let's get ready to learn and to grow mentally and physically with Dr. Victor and Sherry Blake. Be blessed.
Hi, ladies of joy. I am so glad we're together again. It is so nice to see each and every one of you, and I hope you are having a great day. I know it has been a long time since we've been together, and I'm sure you're looking at me and going, who is that man beside me? Who's that handsome guy? Well, this is my husband, Dr. Victor Blake, and I'm going to let him introduce himself a little bit later. But I want to let you know we are so grateful to come together today to talk about both mental and medical. You know, it's two parts to health. In fact, it's funny because as a clinical psychologist, I take care of the mental part, the emotional part. He takes care of the real stuff, the physical part, the hard stuff. So in a minute, we're going to talk about both of those in relations to COVID-19. I want to first thank our wonderful First Lady, Sister Miriam Salters, for allowing us to do this today. And the Light of Joy Girl Team. What's that? Light of Joy. What did we call ourselves?
Joy Girls.
Joy Girls. I'm getting it all twisted up. I want to thank everybody. I don't care who you are. Most of all, for everybody tuning in, because we have some good information for you, and I want you to stay tuned so we can talk about it. And I want to start by just saying, you know, who knew 3 months ago, 4 months ago, that we would all be in the position we're in now. We're sitting at home, we're quarantined, the stress is out of control, we're out of control physically, emotionally, mentally. And so this is a time that we really want to bring you some information, hopefully to help. So I want to start with my dear husband by having him to introduce himself.
Okay, well, I'm Dr. Victor Blake. I am an internist. My specialty is internal medicine. I'm a professor of medicine at Morehouse School of Medicine, and I've been practicing for 35 years. So my long time. So I'm here to basically tell you about how it is on the front lines, and to answer and give some answers to a lot of the questions I think that people are wondering about and worrying about from there.
I want to start with then, you know, as we have this conversation, what is COVID? You know, we hear COVID-19. What is that?
Well, COVID-19, let's talk about COVID in general. COVID is not just one thing, it's a family of viruses. Actually, most types of COVID cause the common cold. And are not as dangerous. It's just this new type of COVID is we call it COVID-19 because it was discovered in the end of 2019. Is a lot more lethal. So the thing about it is you can catch it as easily as you can catch the common cold. It's just the difference between the common cold is that 7 to 10 days you'll shake it off, and with this COVID, it can kill you.
Wow. What are some of the symptoms? What should people be looking out for? And make sure I'm clear, it is not a common cold.
Well, different types of it. Remember, there are different types of COVID virus, just like there are different types of the common cold. The reason people get the common cold over and over again is because there are 99 types of cold virus, at least 99 types of cold virus. So you might get this one, okay, you're immune to that one. Then you'll get number 4, number 7, number 18, and different ones, and so you get and you'll notice as you get older, you get less colds because you've collected all your viruses up together, so that you don't all the numbers up together. However, COVID, again, COVID can give you is one of the types of viruses that can cause the common cold. But this particular coronavirus, let me be more correct about that, because I don't want to say COVID, because COVID is specific for this type of virus. Coronavirus, of which COVID is one of the coronavirus family, can cause different types of coronaviruses, of which there are many, can cause the common cold. However, this particular type of coronavirus, it's like you having a family you got a family full of kids, but kids, and most of them are nice and might cause a little trouble, but then you got one that's just going to be a baby's kid, and one that's going to be out of control. It's going to be out of control. It's got a wild streak in it.
So what are some of the clear symptoms we should know in terms of COVID-19? And then, you know, if you want to look at the difference between that and a cold, but what are the symptoms we should be looking out for? Because we don't know if it's a cold, if it's COVID.
And that's the thing and that is the challenge with it. Particularly, the truth of the matter is this virus, as physicians, we're learning about this virus just as we're the same regular public is learning
So you're
learning
telling
about
me
it.
you don't know any more than I know?
Oh no, I know a heck of a lot more than you do. I'm dealing with because I went to school for this.
Okay, well then that makes me feel better. Okay, go ahead. So what are some of the symptoms?
But it's called a novel coronavirus because it's new.
Oh,
and so we know how to treat these types of viruses in general, but this new one, like I said, is a baby's kid. So what the symptoms are that people will commonly get when I see patients with this, typically the most common symptom that I see patients have a problem with headache, fever, most of the time, nasal congestion, sore throat, loss of sense of taste and smell. Those are the first two indicators. Those are the ones that kind of get my antenna up, and those are the ones I get that say, look, you've got to monitor yourself more closely. But when the most dangerous sign is when people start getting short of breath. And when I say short of breath, I don't mean just you sitting down short of breath. I mean when the usual trip you take from your bedroom to your kitchen, all of a sudden when you're halfway there, you're breathing like you've done run a marathon. People, the mayor's husband was complaining that he was Mayor Bottom's husband was complaining that when he went down to the mailbox, he was like, he goes to the mailbox every day. Now then all of a sudden, halfway to the mailbox, and he was out of breath. And so when you start seeing that symptom, and particularly in for persons over 60 years of age, I'm quick to, and I've been fortunate enough and blessed enough to save quite a few lives by getting people to the hospital a few times. She and I have even worked together to save a couple of lives to getting folks to the hospital.
That's really important because a lot of times, especially black folks, and some other people too, we don't want to go to the hospital, so we will wait till the last minute. So when do you pull the trigger? Is it when you first start having the breathing problems and you sort of catching your breath? Is that the time? I think that is, but I'm not sure.
Well, really, in terms of when you pull the trigger would be kind of depends on what your age group is. Certainly if I have a person who, and whether or not you have other medical problems, and the other medical problems that make you at more risk of dying from this are high blood pressure, diabetes, obesity, lung disease such as asthma. Those types of things will make you at more risk for getting for dying from this. Yeah. So if you're a person that's say 63, 64 years old and you've got a history of things, and particularly if you're on the heavy side, which many us Americans are, Americans are, those are the times where I would say if you're losing your sense of smell and taste, it's time to go to the hospital. Now with the younger people, I monitor them a little bit good. They might lose their sense of smell and taste, but the younger people with no other medical problems, I might monitor them, and I'll have them call me or contact me several times a day by our internet system to communicate with us about what their symptoms are and following their temperature and make sure their temperature isn't above 100.4. Once folks say temperature starts going above 100.4, and particularly if you get the short of breath, then I'm really looking to get you over to the hospital.
Yeah, and that's so important because we do tend to wait a little longer than a lot of people to seek treatment. And you want to start looking at the symptoms before they get to that point, right? And
people get scared. People are scared to go to the hospital. Yeah. Now let's address this scared to go to the hospital thing. Everybody be scared to go to the hospital. Believe me, the notion is, and the belief is that the COVID is the virus is just rampant in the hospital. And the truth of the matter is, we screen no one gets into the hospital without their temperature getting taken. No one gets into my office without getting screened. So in many ways, we've got the COVID people kind of walled off to one side, and the fact that we screen a lot of people, in many ways, it's actually safer in parts of the hospital than in your department stores where nobody is screened.
That's a good point. That is a very good point. So with all of this from a medical, what can we do? Because, we talk about masks. Talk to us a little bit about some of the things we can do. I know we can wash our hands. Tell me, I know we've all been hopefully washing our hands and sanitizing our hands and the doorknobs and trying to keep surfaces clean. And, you may want to touch base in terms of how long this can last on a surface, or how long it can last on a doorknob, or whatever the case may be. But more importantly, if you'll talk to us a little bit about the mask, because I know you had to teach me how to wear one too.
Well, masks are very, very, very important, and we're talking about. And I've heard the other day that one of the school principals was saying that she wasn't going to wear a mask because she was covered by God. Now, listen, folks. There's a thin line sometimes between faith and foolishness, and so we have to know. And the way you know that, you got to meditate on your faith. A lot of people professing faith without adding that wisdom to it. So just realize that. But what we know that works is that when it comes to viruses, if the virus has nowhere to go, it's passed from person to person. If the virus has nowhere to go, then it is going to die. So what that means is, how do we keep the virus from going from one place to the other? Hand washing is a big thing, particularly when you wash it. It's happy birthday to you. Sing the happy birthday song twice with soap. And if you're using hand sanitizer, make sure you're getting in between your fingers, and also make sure that the ladies with the acrylic nail, the ladies with the acrylic nails, make sure you that's a scrubbing, because the acrylic nails can be a hiding place for this virus. They may look nice and shiny to the naked eye, but to the COVID virus, it has a whole lot of pits, which are the sizes of football stadiums, as far as they're concerned.
Wash our hands and wash our nails, but don't take our nails away.
You ain't got to take your nails away. So let's just start with as far as masks are concerned. Let's start with the mask that I see most commonly. This is the so-called surgical mask. You got to make sure certainly you wear it, and above all, keep that part of the nose pinched, and keeping your mouth keeping your mouth and nose covered. Walking around like this, which I see a lot of people. It's like a guy walking around with his underwear half on. You gotta cover your nose. The main way of entry is through your nose. And so what happens if you're walking around like this? I see people in the store and what have you doing this. That really, you may find out be wearing a mask if you're going to do all that. So this area needs to be pinched down close and tight and nice and tight, so that you can keep it. Yeah. So you can keep that from getting in. We know, just if you try a little experiment with yourself, we know that if you take your hand and just do this, you can feel the air right on your hand, just at arm's length. And so with that mask, what it does, it keeps it from traveling as far. We know, for instance, that a person that wears a mask, if you have two people wearing a mask, you can get, just with this mask alone, 85 to 90% protection from just alone, when you are inside of so-called social distance, so-called 6 feet, where I'm more inclined to think it's 8 to 10, but 6 foot, so-called 6 feet. That's one mask. Then there's the cotton mask, which I see is very, very popular. This is also very effective, at least as effective as a surgical mask. Again, keeping nose and mouth covered. None of this nonsense. Keeping your nose and mouth covered.
In fact, I saw somebody with their mask under their chin.
Yeah.
It's why?
All the time. What's the point? Yeah. And so and then there's a so-called N95. People hear about this. This is an example of an N95 mask.
That's a serious mask.
This is the one that the healthcare providers antivirus. These are the ones that we use in the hospital. Matter of fact, not only do I use this one, but I use this on top of that one, you know. But basically, N95 literally means that at least 95% of the droplets get caught in here and caught in the mask, so it protects you. And again, when you wear this N95 mask, you have to get both of the bands over. Go for the bands over, and then the nose has to be in such a way, it has to be tight in such a way that you can breathe like that. If you have, yes, if you can't feel it. If the mask is wearing in such a way that if you do this and when your glasses fog up, it's not on tight enough, okay? And so keeping the mask on like this, so you can get N95 first, but still make sure you pinch this area so you're covered.
I was in the store and my glasses was fogging up, and I remembered what you said, so I had to go back, pinch the mask, and it did. It stopped it, because if you're breathing and your glasses are fogging up, you know it's not all right. So he taught me that.
Now there are two types of protection that are either one used improperly or one that actually makes matters worse. This is a common use. I see particularly young people, they like wearing these type of masks because it makes them look cool and makes them look, I don't know, gangster. And so they're looking like this. The problem with you're looking like a bank robber. The problem with this mask is that it is so thin. If you can see your lips moving, the mask is too thin. Okay, and so it is so thin that it actually breaks up the particles of the droplets with the virus and increases the number of viruses that gets into you. And so this is the type of thing. You don't want to go this way, okay? You really just don't want to go this way with this one.
One of the things I heard about that one, they were actually initially designed to be breathable, you know.
Yeah, that's the whole thing. This is for runners, because it's easy to breathe, but I can still feel my breath through this one, okay?
That's right.
And so this one is just not the way to go. It may look cool, but it's not. And now, one last thing I want to talk about is the face shield. Now these are the face shields, standard face shields, 3D printed face shields that we use in the hospital when we're directly dealing with it. But we also wear an N95 mask. But I see people walking around with this so that they can so their face can look good. They don't want to mess up their makeup or their beard or what have you. The problem is it gets around and can get into anyway. So this type of mask is really unless the shield without a mask is a waste of time. So those are mine.
And that is the issue, because as women we don't want to make
the makeup.
We don't want to mess
and
up
and I won't say anything, but most of the time when I see folks, that it's usually the ladies,
but,
because they want to keep looking good and cute.
I didn't realize how much of your makeup comes off when you're wearing it like you're supposed to wear it.
Yes,
but it's a price to pay.
Yes, my wife is running through mask.
A lot of times people let their guards down with people they know, and we get together, we know we're supposed to stay 6 feet, we know we're supposed to do this, but we tend to say, oh, I know he didn't have it or she didn't, and we'll let our guards down. So we need to remember, I don't care if it's family or friends, when we're around, we need to make sure we're wearing the mask.
Right.
Make sure you're wearing the mask.
Yeah, because COVID don't care nothing about who you know.
That's true. That's a good point.
They don't care nothing about who your friends are. They don't care nothing about who your friend. Don't care nothing about who your family is. As a matter of fact, most of the time we're finding that we're getting outbreaks. We had a patient who admitted to the hospital, then had to put in the intensive care unit just the other day because she went to a family gathering, and when you're in your family, you tend not to have your guard up as much. And then 7 people came down with COVID, and she got it, and she was, by the time she got to us, she was could hardly breathe, and so she ended up in the ICU on a respirator, which unfortunately she still is now. So we don't know. We had to put her in a medically induced coma.
That's really hard. And you know what? One of the things that we miss is that social. And I'm going to talk about that aspect in a minute. But one of the things
that's
too,
what I have questions about.
we tend together to eat. We tend together for social events where we always have to have food, and of course you're going to take the mask off. But while we're talking, I want to ask you about, because this is the fall, where we're going into the fall, and kids are going back to school. Share a little bit about that, and what do you think?
Oh boy, yeah, this is.
Thank God we're empty nesters.
Yes, our kids are grown out of our house and out of our pockets.
Yay.
So that's for the most part. In any case, yeah, there are a number of things that people complain. I'll come to the school piece in a minute. But one of the common questions I get from patients is. Patients is, well, how long is this going to last? When is this going to end? When, how long? Well, let's kind of put it in perspective. The longer we delay with this, the delay with our behavior, the longer it's going to last. But put it in perspective, the 1919 flu epidemic, which killed millions of people worldwide, lasted about 2 years, and there were a couple of different spikes. So now, of course, our technology and our knowledge of what to do is a lot better nowadays, and so we can, in terms of our preparation to prepare of a virus or something, a vaccine, we can do it a lot faster. Realistically speaking, there's so many natural steps. It just takes time. You have to make sure that it's safe. You have to make sure that it works, and then you have to make sure that it works in large populations of people, and that takes time. You got to find volunteers, make sure it's safe, and then give them a number of weeks to months to find out who's going to get it and who's not going to get it. So this whole notion of getting a vaccine by the end of the year, I think is a stretch. We as physicians have figured out different ways to treat people, and this is part of the reason why the death rate was going down, but now it's going back up again, as the Israeli studies show clearly that once kids went back to school, the rate was going down. As soon as kids went back to school, the rate went right back up again. And so right now, realistically speaking, the evidence is in everybody's face. I don't have to say to you that you send your kids back to school, you're going to take a risk to them getting infected. Now, one of the things I want to show to kind of illustrate that is I've got my trusty bowl of M&Ms.
Of course, I'm not eating these. They just happen to be here from people that come in.
Oh yeah, that's it. Yeah, right. Anyway, so let's talk about the risk. So if they say take this your risk, they say your children only have. Would you eat any of them? Probably not.
No, I think you would have a lot of M&Ms.
You'd have a lot of M&Ms left. You'd have a lot of M&Ms left. And so what that tells you is, yes, children can get. And what we're going to see is, we're already seeing an increase in the number of children getting as children go back. The reason why they weren't seeing children getting was because when we took all our kids out of school and come home.
And they were home all summer.
And they were all home all summer. Now that they're going back, we're unfortunately starting to see increases in death rates amongst children, and we're starting to see increases in cases, big increases in cases.
Yeah, and just like you said, with the M&Ms, it's like all the kids, and I don't care if they say it's only 1%, And if 1% of that bowl, like you said, had poison in M&M, would you take a chance?
Would you take a chance?
So would you take a chance in sending your kids
with your
back?
child? Would you give you give your child one of those M&Ms if I told you that one or two of them were a deadly poison? No, nobody in their right mind would do it. So you keep that in mind, and that's what brings me to the other concern about this is that so vaccines are not necessarily coming, but my challenge a lot of times is that my patients, when they come to me, people are terrified.
Right.
People are traumatized, and this is where I need help from professionals like her, and this is why this is why my dear wife, the psychologist, has been more busy than ever. And so my question to you is my patient, again, they're terrified, they're traumatized. One patient, I thought that I walked into a room at the hospital the other night, and we had the patient on the monitor, and I said, well, I think we're going to need to move you up to intensive care. Her heart rate on the monitor was about 100, between 99 and 100. Her heart rate immediately went up to 135, just with the thought of it. And I've had patients' blood pressure go up just with talking about this. So
it is.
What do I do, and what can we do to get our patients from being so frightened, and the psychological impact I know is going to last way longer than. So when she talks about what I do, no, the real stuff is going to be long term, because most of illness is not. It's about what it does to your spirit, what it does to your psyche. All illness is experienced through your psyche, and so. That's my question for you: is what do I tell my patients?
Well, it's not just your patients that are terrified. Everybody's terrified. It's the whole idea: am I going to catch it? What am I going to do? Who am I going to lose? Can I say? You can't do things. So first thing I say, breathe. Just breathe. And people even say, I breathe all the time. No, I'm talking about breathe for relaxation. We got to calm down. So what I always tell people when I say breathe, take air in through your nose, hold it for 3 seconds, slowly release it through your mouth as if you're releasing through a straw. Breathe. Once you're able to calm your body down, then you can start thinking, because we have so much coming at us. We are grieving. I mean, this whole society is grieving, and that's part of the trauma and the whole bit. We're grieving the loss of job. Right, first of all, we're grieving the lifestyle we
loss of normalcy.
The whole sense of normalcy. Everything is out of control as we have known it to be. And so now we have to look at, what's going on? And when I say grieving, we're grieving our lifestyle, we're grieving the loss of loved ones, and we know people are dying. And it's very unfortunate. African Americans are dying at a higher rate than many other groups. So we know we're getting it. So, but people say, well, is that because we're not wearing masks? No, because of our health conditions, and we're on front lines in jobs like you. And I must say, my dear husband has done an excellent job during this time of trying to take all. Well, of course,
she won't let me in. She won't let me in the house unless I completely change my clothes in the garage.
Right.
And she sends me downstairs to take a shower.
In the laundry room.
Yeah, she'll let me in. I can get as far as the laundry room and then go take a shower. I can't.
Right. And that's so important. But the whole idea, and that's something new. All of this is new for everyone. So we have to be cautious. We have to be very intentional. So the first thing we have to do is understand the losses. We've lost our loved ones, and people are really leaving here. We've lost our jobs. Many of you can't work from home, or if you do work from home, that's a whole new world when you have kids running around. Kids have been disconnected from friends. We can't have weddings. We can't have birthday parties like we used to. We can't even have funerals. So one of the things that's horrifying in all of this, we can't even have a homecoming like we used to for our loved ones. I mean, and that is something that we had, especially as African Americans, relied on for support to help us through hard times. So now we have none of those external support systems to rely on. And if you're living alone, you're feeling isolated, you're feeling real thing. So all of a sudden the idea of getting COVID or being in the hospital or going to the hospital, and if you walked in my hospital room, to be honest, with all that gear on, my heart rate would shoot up too. My blood pressure would be going, yeah. So, you have to, but I have to self-control and understand why you're there. So once we deal with the losses, there's so much anxiety. And I mean,
and believe me, I've been blessed enough I'm blessed to have a clinical psychologist, a PhD clinical psychologist, because there have been more than enough times then I've had to call her to keep getting me to calm down. Just the other day, I said, because we're having people that are closest. I'm losing colleagues, people that I went to medical school with, people that colleagues that I've known, that she has known for years, and that have so doctors and nurses, we are dying, and so I end up, and as for healthcare providers,
right?
We
bounce off each other.
Fortunately, fortunately, I have her expertise to help me, but she keeps me from freaking out.
Well, on the other hand, he keeps us safe. But the reality is, you're human. So is all the healthcare, and that's what I keep saying. We're all human. We're all entitled. Yes, we don't want to live in a world of fear, but we also have to understand we're human. And so we have, when you have colleagues and everybody else, that you work with, it's getting sick. It's very scary. So the anxiety increases. Part of anxiety is the fear of what has happened, and most of all, what may happen. So now what happens is you're so busy looking at all these other people and all the things that has happened, then you get that internalized to, oh my God, what's going to happen tomorrow? But we have to, and I tell people, stay in the here and now. Okay, yes, another person, your loved one has died, breathe. You're here, I know you, and then you have to sort of walk people through the process. Depression has set in, and I mean depression like no other. And even our former First Lady, Michelle Obama, talked about recently feeling depressed because, think about it. You really can't do what you used to do, and it's sort of feeling isolated. You can't reach out and touch your loved ones. You can't go to the home. There are a lot of things that we have just lost in this process. But the good thing is that when you feel anxious, when you feel overwhelmed, and a lot of times you do feel low, I want you to just pull back, slow down, sit down, and sometimes we just have to be still. We have to disconnect. Turn the TV off. I tell somebody
she wouldn't let me. She stopped me.
Turn CNN and all the news.
She made me stop watching because the more again, and I knew today. Of course, I had to go straight in and go into it. And I'm now at the point we all as healthcare providers, she helped us get together and all admit to each other that we are afraid. Yeah. But this was the oath that we took. So this is what we have to do. This is what we have to do. But now I've just gotten to the point where most of us are getting angry because we're seeing people die that shouldn't die.
Well, thing is, you have, and that is real. Disconnect from TV. Disconnect from the news. Take some time to meditate. Slow down and get into self. Meditate. Breathe. Understand. Pray. Take walks. We do things so quickly and we're right. Take walks. Get into nature. Understand who you are. Use this time to connect with family through internet, through Facebook, through all the stuff.
We do that. Yeah.
We do a Zoom call, a family Zoom call.
Every other week,
Connect with other people. Although you may not be able to touch them, boy, it's really great to laugh and see what's going on. We have to do that because guess what? That's our normal right now. And when we do get back, the normal is never going to be what we had it before. We have to understand that. So given that, we have to take a pause, understand that this is where we are now. Breathe, pray, and understand that God did not give us the spirit of fear. So this too shall pass. Now, when it passes, we'll all be back. But we have to hold on to those scriptures that get us through where we need to be. I know we got to wrap it up. So I just wanted to ask if you had any short comment, and then we'll close it out.
No, other than, everybody just wanted, everybody what the way she's helped me to recognize the way I did to calm myself down and be focused is I know exactly what to do to keep myself safe, and I do that. So it's like it's like being in a war. You don't get up and walk through a hail of bullets. You get your head down
and do what you need to do.
And do what you need to do.
So with on that note, again, don't feel afraid to reach out for help. If you have a question, call people, get the help you need, get the professional help. And you can find me on my website at www.askdrsherry.com, or you can follow me on social media at Ask Dr. Sherry. It is so important and I want you to do that, because if you have questions, you can ask those questions and I can get answers for you. And we're here to help. And I want to thank again our First Lady, Sister Miriam Salters, for allowing us to do this. And most of all, I want to thank my dear husband for taking off some time to do it with me.
So the only other thing I'd want to add is that I think people are not making use of their primary physician enough. Call your doctor. If you've got a question, call if you have a primary care physician, call the doctor. I can't believe how many people will just wait until it's too late. And I find out that patients are in the hospital after the fact. Call your doctor, and they'll be able to help you walk your way through this to keep from the worst things of happening.
So bottom line is, call your doctor.
Call your doctor. Call this type of doctor. Call this type of doctor.
But if you got a temperature, call him. Because our schedules are like this. So in the meantime, everybody stay safe. Thank you.
Okay.
Appreciate it.
Okay.
Bye-bye.
God bless.
Wow, ladies, that was amazing information. Thank you so much to Doctors Victor and Sherry Blake for sharing those tips, those tools of wisdom. We appreciate you so much. Make sure that in this season, ladies, you're not just taking care of your spiritual selves, but also that physical and mental being, because God wants us whole. So take care of yourselves, mask up, use that hand sanitizer, wash your hands, whatever you need to do to be safe, because that is how we get one step closer to fellowshipping together. Until then, we're here virtually for you. So don't forget, if you're on Instagram, go ahead, get to that search bar, type in Joy Girl, or you can visit us online at joygirl.org. And once you get there, all you have to do is click watch, and we'll be there waiting for you. So until next time, enjoy. We love you, and know that we have amazing content coming, just not for you, but those Joy Girls you have as well.